My role here it's really two parts. I have I would say a clinical responsibility as well as responsibilities of being a managing partner. So I really am very intimately involved in not only patient care but also the overall operations and management of the company. So I work hand in hand with my other partners as well as our CEO or CFO, Percy Naranjo, to get our facility to be one of the most top-notch facilities for non-surgical orthopedics. I would say the most common thing that we see here, and just as a backdrop to some of the things that are unique to this market, is that there are orthopedic groups, there's family practice groups that do sports medicine, there's physical therapists, chiropractors. The most prominent thing is that, well, there's, I would say, two things. For the patient experience is such that they would go to a doctor and they would have a bunch of prescriptions and orders to do. And then they might find their way to an orthopedist and maybe a chiropractor elsewhere, and then maybe do therapy elsewhere. So they're really just traveling a lot. So from a patient perspective, there's a lot of time wasted. The fact that we have all this under one roof, it makes it very efficient for the patient. So they come in and they have everything under one roof, and they don't have to travel so much to get the kind of care that they want, because everyone here communicate rather seamlessly or relatively seamlessly. So you don't have a doctor saying one thing, the therapist contradicting, and the chiropractor making other totally different recommendations. So the patient experience is unique in that sense. The other thing, the flip side is also is that we offer something unique enough that it offers patients a lot of hope. I mean, a lot of physicians out there, unfortunately, have given up on patients, and I see it time and time again. And we provide something unique and different, and they say, you know what, doc, you've given me a lot of hope when other doctors have truly given up on me. So that's really from a patient experience side, that's what sets us apart from other practices. At the end of the day, I tell patients the bulk of orthopedic surgery is elective. You know, it may not be as elective as, say, a facelift, but it is ultimately elective. It's most orthopedic conditions we treat are not life-threatening. Many people live with these conditions. The surgery is by choice in many ways. So having the risk of surgery is a real risk, because there's risk of infection, there's risk of post-operative complications, and patients don't really want to deal with that. So we offer that alternative, safe alternative to some of the surgical treatments. What most patients don't know is that, and depending on the studies that you look at, over 90 to 95% of orthopedic conditions do not need surgery. Another study looked at primary care patterns in terms of when a primary care physician or other sports medicine doc would recommend surgery. They would recommend surgery in up to 20 to 30% of their patients. So there's a disconnect. We see studies on one aspect saying, well, only 5 to 10% actually need surgery. And then in common practice, 20 to 30% of the typical patient gets surgery. If you look at our practice, less than 5% ultimately get surgery. So that's, I think, a big difference as well. Some of the conditions I treat are what I call head-to-toe orthopedics, so in a nutshell. So in head, it's going to be headache conditions that I use acupuncture for. I use Botox injections for this condition. I treat neck pain, shoulder pain, various spine pain, so from neck, upper back to lower back, hips, knees, and foot and ankle. So conditions, rather, foot and ankle conditions. So these are, in a nutshell, some of the conditions that I treat. What drew me to this field of medicine was the fact that I was always fascinated from, I guess, the sports realm. So my background is that I am a certified strength coach, and I also had tremendous experience actually working as a consultant for supplement industries to generate different food products. So I had this idea, well, I love medicine, I love looking at pathology, but I also love sports performance, I love training athletes. So I wanted a career that combined, that kind of bridged the gap between medicine and sports performance and high-level performance. To me, the best choice was physical medicine and rehabilitation, or PMR, also known as physiatry. And I really see the continuum. So I made a career choice that actually made me see injured athletes, or even just non-athletes who are maybe injured at work, home, or active individuals. I see them when they get injured, and I see them through the rehabilitation process, and then when they want to perform at a high level, I see that as well. So I really believe I've bridged that gap, and I think that's unique to my specialty. No other medical specialty offers that kind of service, and that's pretty much what drew me to this particular field. Medical acupuncture is not an acupuncture treatment because it's given by a medical doctor. Okay, so medical acupuncture, to be specific, simply means that I use acupuncture to treat pain, but I explain its benefits through science. So I don't need to, for instance, I really avoid things like meridian points and energy points and things like that. I tell patients there are good scientific studies on acupuncture. There are what we are uncovering many scientific processes or biological processes to explain why acupuncture works. Is it the complete picture? Absolutely not. But I use science to explain the benefits of acupuncture. And that's really what sets medical acupuncture apart from, traditional acupuncture. What makes performance spine and sports medicine unique are the following. One, we offer so many non-surgical approaches to treat pain and acute musculoskeletal conditions under one roof. So there is a team approach that we talk about all the time with patients, where it's a coordinated care between medical, physical therapy, chiropractic therapies, and also our sports training coach. So there's a vast continuum. Number two, we really set ourselves apart from a business operation standpoint. So what we've done was combine good medicine and good business, and what you have is essentially performance spine and sports medicine. So what that means is we pay a lot of attention to detail. The patient experience is unmatched or unparalleled in this industry. So from when they first talk to our secretaries in front to when they actually visit us, they have an experience of professionals that not only care about them, but also the ancillary staff really puts a lot of effort in helping them manage or navigate through all the administrative processes that patients might go through. So we really pay a lot of attention to that level of detail, and I think that's what's unique about our practice. What makes performance spine and sports medicine a good choice for many patients who have seen many doctors in the past is the fact that we try to strip down as to what is the most appropriate treatment. So for instance, many doctors, because they are of one particular specialty, they only think of one tool to treat a patient. So for a surgeon, it's surgery. If it's a typical pain doctor, it's going to be injections. We try to have much more diagnostic precision in terms of what is causing the pain. So we're all about what is the diagnosis, what exactly is going on. And number two, we offer not only the current treatments as we know it, but we offer some of the most cutting-edge treatments that are available that we offer to patients. So you will, or a typical patient rather, would hear things they would never hear of, from regenerative injections, which is coming into play more and more. Many physicians do it, but most physicians do not practice specialized injections to regenerate their injury. We also do a lot of research in terms of injury prevention. So we're making recommendations that many other doctors don't do, because we really look at the patient's movement patterns, which is very unique. It's called biomechanics. So we try to integrate things that are in the research right now and apply it clinically to our patients. And we do some of the original research ourselves. So these are some of the things that set us apart from other practices as well. In the end, it's all about helping the patient manage their pain and live a full life, a quality of life that they want to achieve.